Hello, everyone, and welcome to another episode of the Low Carb Lifestyle Podcast. We're here today with Deepa, who is one half of the Sydney Low Carb Specialist team with her husband, Alex. Thank you so much for joining me on the podcast. It's been a while that we've been trying to get this chat, and I'm really excited that you're here with me today.
Hey, Tracy, thank you. It's been great to be invited onto the podcast, and I'm excited to have a chat today.
Yes, so am I. So I would love you to share with everyone, obviously, who you are, what you do, and then how you came into the low carb space.
Sure. So I'm a doctor in Sydney. I trained at the University of Western Sydney and then went on to train as a GP, so through the Royal Australian College of General Practitioners. Overseas, that sort of credential would be known as a family physician, I suppose. But it's sort of something I actually wanted to do even before I started in medical school. So I'd always sort of known going into it, unlike many of my med school colleagues who kind of, flitted in between this and that. But I think the main driver for that was I was always interested in prevention and preventative medicine. And I knew that that would be most achievable in the community rather than in hospital-based medicine. So that's always where I was kind of very driven towards in my career. And then I think when I started practicing in GP, I think what I started to find was a little bit of disappointment that probably everything I thought general practice would be, I was only really experiencing 10% that was very satisfying for both myself and the patient, in the sense that I was helping them to maybe prevent or preempt something. But most of what I was doing was really Band-Aid work, and it was focusing a lot more on chronic disease management, some of which was sort of limited, I suppose, by the amount of time I could spend with a patient, because generally in general practice, you're only really got 10 to 15 minute, maybe even 20-minute appointments on average with your patients. So it just didn't seem to be everything I had hoped for. And I started to wonder about why are we practicing medicine like this? And is there another way where we can look at the root causes of illness? And knowing those root causes, how can we reverse chronic conditions? And then also, how can we optimize good health when it's there? So that's, I suppose, part of what drove me, I guess, into the low carb space. And then, like a lot of other people in this space, I've also got my own personal story as well, in the sense that when I was in my last year of medical school, I was actually sitting my final medical exams, and I got excruciating pain out of the blue, just really terrible pelvic pain, and which just got worse as the day went on. And I said to my husband, Alex, who, we'd just been married for only 6 months at that time. I said, oh, look, I think I really do actually have to go to the hospital because it's just getting worse and worse. And then 2 or 3 days later, fast forward to sitting in the gynecologist's office being told that I had stage 4 endometriosis. So it came as quite a shock, really out of the blue. And then sort of going through, I suppose, the treatment for that, and then having surgery, which was very effective. It did help greatly with the reduction in symptoms. But then being told I would need to go on to some sort of medication to keep the endometriosis at bay, because I now had this chronic condition that could recur. And that treatment was to induce menopause, or at least temporarily, to really halt the disease. And then at that stage, I wasn't in the right time or place to be having children for our individual situation. But they said, that would all easily reverse whenever I chose to have children later. But to me, that was quite horrifying. And I wanted to look for another way to manage my condition in the long term, something that might treat the root cause. And that's sort of when I fell more into into looking into diet, which drove me into looking into the sort of paleo way of eating first initially, and then and then at that time, that kind of coincided with when Gary Fettke was talking a lot about nutrition. And I followed a lot of his work, and then eventually, I was in GP training, and I actually saw some patients that had adopted a lower carb approach, and went on to think, okay, how can I actually get some more education and training about this, because it's certainly something I'd never come across. Nutrition training is literally one session in medical school, so 1 or 2 hours. And so we went to, so Alex and I went to the Low Carb Down Under conference, and I remember that really clearly because of sitting in a room with probably back then it was only 150 to 200 people. This was 2017 on the Gold Coast. And the keynote speaker was Nina Teicholz, author of Big Fat Surprise. So when I listened to her talk, I was just blown away by how much I'd been taught, and how so much of it, because we'd never sat to critically evaluate that, we'd sort of accepted the literature as, as gospel, I suppose, that there was actually quite a lot I had to unlearn and then also look at again with a critical lens. And that's, I think, when I truly embraced learning more about low carbohydrate medicine. And I suppose to come to the point of where I am today, so, running Sydney Low Carb Specialists together with my husband. The two of us just really found that in general practice, just the time limitations and the fact that you can't really spend a lot of time with a person and get to know their whole context meant that we really had to take it out of our general practice and focus on that to really give it the meaning and the effectiveness that we want to bring to it. So that's sort of where that came from, and also to work with other dietitians as well. So the thing that we found really great was being able to work with two fantastic dietitians, Natasha Fail and Kate Osh, to be able to provide a lot of this information to people once we consult with them as well. That's sort of where Sydney Low Carb Specialists started, was as a way for us to deliver this kind of medicine to people and look at the root causes and look at how nutrition impacts on disease.
Amazing. So how did you find your colleagues, what was the sort of attention that you got when you stepped out and did this? Have you had any backlash? Have people been, supportive? Because it's still overall, as you say, nutrition just does not come into the picture mostly when it comes to medicine. And, to me and obviously to you, it's so fundamentally important that it does, and it affects everything, right? So how was it? I mean, was it scary? Did you find that, it was an easy decision? Have you just, I'm really keen to know what it was like.
I think it was the decision to go into this space certainly meant that we had to be quite vulnerable, and also to be able to defend some of our viewpoints as well to our colleagues, if they were to ask about, what is a justification and what sort of improvements can you see, and what are the negatives as well to looking at nutrition. And so I think, the pros and the cons of what a low carb diet or low carb medicine can offer people. And so I think, and also because I'm at such an early stage, or at least I feel it's an early stage. I'm only 33 now. So it's, I feel like I'm pretty much at the earliest part of my career, and hopefully I've got many, many decades ahead of me. So I felt I didn't have, I couldn't say that I was an experienced doctor or someone who'd practiced for a long amount of time and had a whole patient base that I could reflect upon, which a lot of luminaries in the low carb space would have, because they've practiced using really both ways, or both sort of forms of medicine, I'd suppose. And But because I've learned a lot from these people and from what their observations are of the way they used to practice and then the way that they now practice using nutrition as a real fundamental part of their practice, I think that made this transition seem like a no-brainer, that it was something that I had to evolve to. And because I was so passionate about that field that if I'm not truly doing something I believe in, then I probably would never really find the satisfaction that I was looking for in general practice, where I was, confined to having to use the dietary guidelines, the standard dietary guidelines for everyone, which is what we're taught in GP training. So I think generally backlash, I don't think there was any obvious backlash, nowhere to the degree of what's happened with, our colleagues like Tim Noakes and Gary Fettke. I truly feel that they have led the way for us quite courageously, very bravely. And that to me is something I'm very grateful for, because it means that I can now practice in a more free way. And I feel that that many organizations are changing as well. So you can see with lots of the different societies, like, there's Diabetes Australia that's actually changed a lot of its guidelines now, and recognizing that nutrition can really underpin it, and particularly low carbohydrate nutrition can help a lot. So I kind of think, yes, maybe initially there was probably a few, sidelong looks and a few, what are you doing? That doesn't seem like the norm. But I think now, just like in the community, there's much more general acceptance, I think, for looking into nutrition first, or as a earlier on in the consult, rather than something you leave as an aside.
Yeah, absolutely. I mean, I actually thought I wouldn't see a huge amount of change in my lifetime in terms of what was recommended. But, we've seen even in the last couple of days, the guidelines for diabetics, has changed, and low carb is now considered an option. I mean, I really actually never thought I would see that.
Yeah, neither did I. Not at least soon anyway.
Yeah, which I think is phenomenal. And it really does then say that, doctors can look at this as an option safely without, risk of going through what Gary had to go through or Tim had to go through, being the ones that did pave the way.
See, I think medico-legal ramifications are certainly one side of it. I mean, that I think has limited a lot of people, and still does limit a lot of health professionals as well, because it's not the standard form of treatment. But I think there are some people as well who wouldn't openly say that they support this way, even though they do feel personally, and they can actually, like you and I, have experienced personal improvements with the low carbohydrate nutrition approach. So, and I think that's kind of the next frontier that we're going to see, is that there are more health professionals who come out, so to speak, to say that actually they do openly support it, even though they have always sort of, personally thought that it made a difference. But also, I think what's dragged people kicking and screaming, or at least dragged the authorities and organizations kicking and screaming into acceptance that, we need to really focus on nutrition, like the food that's going into people's mouths, is a grassroots change, because I think people in the community are so much better educated than their health professionals when it comes to nutrition. Sometimes that education is confused, or it's been misled through the internet or, through other means. But what drove them to look into those things was always well-meaning. And I think they really did realize that there was actually something that needed to change in what they ate. So that part of it is probably quite reflective in the SBS documentary that's aired recently, the Australian Health Revolution. So just knowing that there are people actually on the ground already doing this in Australia, in our communities, has meant that the organisations from a sort of the top level or the management level have to actually change and acknowledge that there has been so many positive effects from people changing their dietary approaches. So I think that might reflect why we're seeing quicker change than what we would have normally expected to happen with something like this. In terms of if you compare it to the low-fat dogma that's really been underpinning dietary guidelines for the last 60 years now, and that took a long time to change. But I think I think now things are sort of in a real snowball effect, so really picking up speed.
Absolutely. So interested to know from you in your practice, so what would you see as some of the biggest barriers for people who are wanting to make this lifestyle change? Because it isn't easy, especially given the context of the world we live in. But what do you see come up, really often with your patients?
Yeah. Look, I think some of the biggest barriers, it is really multifactorial, but I think it does start in childhood. It's what we are fed as children that really, and even before childhood, what our mothers ate when we were, in utero. So the exposure to foods that probably are not part of a traditional ancestral diet from an early age. So all of this exposure does really set the scene. And it means that you can develop this addiction quite quickly to highly processed foods, to sugar, especially. So those two are the real critical things. And so when I'm seeing people, I mean, we see people of all ages. So we'll see children, but we'll see families, and all the way through to the other side, other spectrum. So all the way, up into to having patients see us from nursing homes as well. So I suppose because you get this scene set at such an early age, it's really hard to know anything different. So, and that I also think that's the really unfair expectation is, kids, kids can get away with eating anything. They're going to be fine. But it's very unfair to feed children a diet that sets them up for a major addiction to sugar and processed foods, and then all of a sudden pull the pin on that later on, whether it's in their 20th, in their second decade or third decade or fourth decade of life even, because some people can make it all the way till then before obvious metabolic syndrome is diagnosed or there is any problem. So I think that is a huge limiting factor. And when people start to realize, the impact of diet that their childhood had, like that childhood diet had on them, it is very empowering because they can suddenly start to make a lot of connections and have a understanding in their story or their journey from childhood into adulthood and what may have driven some of their experiences at that time, particularly around their health. So they then we have this really interesting chat about, I did have PCOS and polycystic ovarian syndrome when I was younger, I think, just based on what we're chatting about. Or, I did have a lot of gut problems, and I was probably not, I never really pinned it down to the food I was eating, but it does sound like that can have a huge impact. So it gives people, puts their health context into this meaningful, I suppose, cascade of events, and then they can realize what has driven them to where they are right now. A lot of that then needs to be unraveled. And so the next sort of barrier, I suppose, is how do you put into place, so one is education. So what are the foods that I do need to eat, and how does that interplay with my physiology? So how does that impact your hormones? How does that impact upon what your energy needs are? Like, is this person someone who's already, running marathons and is a sports person or an amateur sports person, or is this person someone who has already come to us with a lot of chronic and complex medical issues? So having to determine, what their specific needs are to fuel themselves. And then getting that right can be a little bit of a barrier because we have to go through not only education, but applying newfound knowledge to their current situation. So that's another barrier. And I think the last barrier is maintenance. So I think a lot of people can start a low carb diet really well. And then again, it's the impact of society, the impact of the food environment, the nature of friends and family to sabotage their efforts. So that's sort of the maintenance phase where I do see there are some barriers as well with continuing on a low carbohydrate underpinned nutrition approach. So yeah, there's I guess you could look at it as an overall like a lifetime approach, because I think for a lot of people, childhood, just because we've all lived in a childhood that was governed by these original dietary guidelines, I think that's always the very first thing to explore, which sounds a little bit silly because it's like, tell me about your childhood. But the tell me about your childhood part is actually really important, because it helps me to understand where, what sort of diet they had and what they really considered was food.
Yeah, absolutely. I think it's so fascinating. Obviously, in my work, I get to help people overcome a lot of those barriers. And I think, all the stuff that's been laid down, we're not going to be able to turn things around overnight, are we? I think we have this sort of false belief that, we can go on a diet for 4 weeks or 5 weeks and, things will completely turn around, and all this lifetime of habits and way of doing and being will automatically shift. Well, they won't. And I think it's unrealistic to expect things to go quickly, but it's also important to know it's possible. It's absolutely possible. It just takes consistency and in it for the longer term, really, because you're not going to go back, because you're going to get what you had if you do. I mean, I've said to people, it took me really 2 years to find my sort of groove. And then it's really constantly changed too as I've got older, and then hormones impacted and different diagnoses and other things that have come in. And I think it's just that, embracing it for it being a long term. You're always going to see things and try different things. It's going to be uncomfortable. That's okay. Change is uncomfortable. But, and you don't have to be perfect at it either too, like that, expecting things to get it straight away. Well, that's really not realistic. And
no,
I think, I just love people hearing, like there are obstacles, but there's also ways to get around them. And I think,
absolutely.
I love sending, my clients to you because, you do that full picture. I mean, and, spending an hour with someone is just, as a patient, from a patient's perspective, is phenomenal that, you can really get their full story.
I think, to that point, you have to really understand that for someone to change their health behaviors, which, you do so effectively from a health coaching point of view, or at least give people the tools to see that they can change their behaviors. From my perspective as the doctor who's trying to assess, what their health is like and look at, and particularly we often see some of the most difficult cases, because these are people that have a lot of chronic and complex medical conditions, is trying to give them meaningful and effective strategies and not reinvent the wheel, because they've often come from a time in their life where they've used a lot of, and I really don't like the word diet, because diet in its traditional form is meant to mean way of eating. And I see low carb as a way of eating. So it's a diet. But the diet connotation, I think the word diet has just been really trashed, I suppose, in the last few decades. And these people have come from that dieting culture a lot of the time, whether or not they wanted to be in it or they got dragged into it. And always being told by various health professionals to eat less and move more, which they've tried and failed with. And that's what I sort of mean by, we don't really want to go back and reinvent that wheel. We want to underpin a new strategy that actually has a scientific foundation in their context. And I think that's a really critical thing, is applying it to the person who's sitting in front of us, and where they're currently at with their health, and what what are some of the realistic first changes we can expect as well. So trying to make it easy enough to start the process, but recognizing that sometimes there are these barriers and that does take a bit of time to overcome.
Yeah. So have you achieved that sasatisfaction, with your practice since you started this up?
Yeah, absolutely. I think it's the kind of job where you go to work and you don't feel like it's work. You feel like you are making a fundamental difference to someone's life rather than just coming in and band-aiding or giving them a temporary solution. You feel like you're doing something that's going to not only impact their lives, but hopefully the lives that surround them. So I find some of the most satisfying, relationships we develop with people have also sort of found their families adopting that way of eating, and they often mention to us, oh, by the way, my child is feeling a lot better, or they're doing a lot better with X, Y, and Z, or my husband has also come along for the ride and has been experiencing these positive changes. And just knowing that there is a bit of a flow-on effect from that person, and being able to hear that there is actually a change in their family dynamic because other people are benefiting not only from them being better with their health and having more energy, but also knowing that those people around them, their children and their wives or husbands, or even extended family, are also noticing changes. That helps us to keep going. It's sort of the fuel the fuel for our clinic, really, because we see all of this and we think, wow, it's actually really making a powerful difference. And we saw that when we were in general practice, but because we never were able to follow people with the amount of time we have now, and I think that has really made the difference, is allowing, giving people more time and then being able to follow them up over time as well. So that's been, it's something I've really observed in our clinic, is it has knock-on effects, which aren't always so apparent at the beginning.
Yeah, that's right. But that's amazing, that ripple effect. Can I chat to you a little bit about your kids? It's always, a conversation I have a lot around, should kids be eating low carb? And a couple of things you've said have piqued my interest. This talk about how a lot of, what we experience in adulthood has its basis in utero and then in early childhood. And, we can be setting our kids up for a lifetime of, of chronic illness and, difficult habits to break. So how have you and Alex, I guess, put this in context with your own children in terms of the decisions that you've made? Because often parents feel that they're being, if they don't let their kids eat sugar or, have lollies at birthday parties and stuff, then they're being a bad parent.
Yep.
How does it look for you? How have you worked that out?
So I don't think I've found the overarching solution yet. Just like with all things in parenthood, it doesn't seem like there's any one perfect way to do it. But what I've sort of slowly over time tried to develop habits with my kids that I hope they will find have underpinned their early childhood and their early part of their development. And just like many behaviors of childhood, if we can try and encourage some really good early behaviors, they may stick, and they may well come back to that later on once they've passed through their defiant teenage years and their moments of risk-taking behavior. Yeah, exactly. So, I think you have to expect that at some stage your children will deviate from and challenge what they've been taught. And I think that's part of normal development. So, but my kids are now, so my daughter is 5.5, my son's 2 years old. So I don't have the teenagers yet. I've got them very much at the younger side. And with my pregnancies, I would probably describe my first pregnancy with my daughter as a paleo pregnancy. I wasn't aware of low carb medicine back then. I didn't know about the ketogenic diet either. I was probably what you would describe as normal body weight going into my pregnancies. I never really had any health issues apart from that endometriosis, which at that stage I'd already managed to control. And I was basically living, without any symptoms prior to going into that pregnancy. But I realized how important it was to actually eat well through my pregnancy. And that, I think, has helped my daughter, because she's, touch wood, is quite well, and she accepts and tastes many different types of foods. And, I think that helped a lot with her. And then with my second pregnancy, my son, I was probably mostly ketogenic through that pregnancy. I was always in a low level of nutritional ketosis, which I could check with, a blood ketone monitor. So I did do things slightly differently with him, because there were so many things I learnt as well from my first pregnancy, just like most mums often, put into play a few different extra things in their toolkit. And I realized that when I first gave my daughter first foods, which was rice cereal, at the beginning, thinking, oh, that might be a good option but I also was, I guess, swayed by what I'd read in the guidelines versus what I thought she should be having, which was real food. So I did a combination with her, but then for my son, I went straight to real foods, real whole foods, and I bypassed any sort of processed food entirely. And so I can see now, as they're getting older, that they have slightly deviated parts, because my daughter, she would maybe sometimes actually accept the more processed foods more readily. And these days she's more exposed to that outside of the home. Whereas my younger child very much goes straight to the real whole foods. And I know that's just an N=2 experiment where both of them have had slightly different starts in life. But I think it's a very interesting and fascinating thing to look at. And I often talk with my patients about, what they're eating and what their children are eating. And it's very easy to control the home environment. So you can very much get children to eat the foods that you provide. And that's the easy part. But the harder part is the older they get and the more influences they have from friends and family, from school, extracurricular activities where foods are offered, daycare settings where foods are offered. And this is the challenge that I'm now coming into with my eldest, because we are now going to go into that sort of next phase where there's going to be a whole lot of outside exposure. So far, been able to keep things fairly, whole foods based for them. And I'd say, they're not ketogenic, but they would be, lower carb. They'd be on a lower carb diet. But I think the main sort of negatives that are raised about raising children in a low carb perspective, like some of the medical concerns, I suppose, would be growth restriction. They talk about children that were raised on a low carb or more, so the ketogenic spectrum, can actually experience some growth restriction. And this is coming from, research studies on children with epilepsy who'd been on a ketogenic diet. But the problem is it sometimes is in the patient population. So there is also other factors at play, such as nutrient density of that diet, both at a macronutrient density level. So sometimes it's a matter of the proteins and fats that are coming in. These children were often on a much higher fat diet compared to the protein in those diets. And also micronutrient perspectives as well. So they may not have been meeting all of their micronutrient needs. So there are a couple of confounders to that original research that people go and pinpoint to say that, oh, your child may end up growth restricted and may not reach their full growth potential. But I think in this day and age, we truly, because we can understand and pinpoint nutrient deficiencies, and we can ensure there is a wide variety in a whole foods, real foods diet, there isn't really, I don't think, that concern about growth restriction is as powerful as what people say it is, and especially with protein. If you can offer enough and have wide enough sources of protein sources for your children with really good healthy fats, you're winning. And I think that's where the growth is not going to be outmatched by a high carb diet. In fact, the type of growth you see on a high carb diet is the kind of abnormal growth you don't want to be seeing. Yeah,
that's right. And that's interesting. I was going to bring that up when I talked to Dr. Pranya Ganathan. He was talking about that, this high, insulin driving, children to be so tall and lean. And you see that a lot. And he was, I think we didn't talk a lot about it, but he did bring it up that he thinks it's, insulin is to blame, because kids are just, living in this environment where insulin is just sky high all the time. It's very, very fascinating, but maybe because I'm conscious of the time of you as well, there's so many things I want to ask you about, but I really do want to get to the topic of diet and either menopause or endometriosis, because you talk about that, and it's obviously something that you've managed with diet. It's certainly, I haven't had a guest on that has talked about endometriosis specifically. Are you happy to talk about how diet did impact that, and so what's actually going on there? Why is it so important, that link, and anything you know about that would be great.
Yeah, of course. I mean, so I think a lot of what I found was through trial and error. So in myself, in terms of the endometriosis that I had, I found that yes, that the impact of a diet in terms of its inflammatory nature of the diet can be quite profound on menstrual health. So I always thought, and I thought wrongly for a long period of time, and this is how I was educated even, as a teenager, was that periods, it was okay for periods to be painful and heavy and sometimes irregular. And I think that's actually a myth perpetuated to a lot of young females. But it's not, periods are, and I've heard this described before, having a normal period or your period itself is like a vital sign for a female. So just like heart rate, blood pressure, and temperature should all be in normal ranges, you really want your menstrual health to be in a normal range. Otherwise, it's a sign something is fundamentally not working in a female body. So when you're experiencing those sorts of problems at the uterine level, because what endometriosis is the growth of the lining of your uterus outside of the uterus where it shouldn't be. So they're almost behaving like tumor-like cells. And as we know with any sort of uncontrolled cell growth, it can be fueled by lots of growth factors, insulin being one of them. So, and I think that's where there is, just like in so many conditions, and I think Ben Binkman talks about this quite a lot, which is that insulin resistance can either be something that underpins it as the main driver or something that perpetuates it. And it's probably both in the setting of endometriosis. I think that it is probably one of many different factors that can impact it. There are genetic factors that can impact it, environmental, and then also, I think with the highly inflammatory diet, in the sense of if you're consuming quite a lot of processed foods, which contain a lot of omega-6, which is pro-inflammatory, you can get a driver going there for abnormal growth. So when you think about the uterus, it's exposed to the vasculature, so it's exposed to the same blood supply that is bathing your heart, your kidneys, all your other vital structures, your brain. But we have to think of the uterus as well as an end organ. And I remember listening to a really great lecture by an obstetrician gynecologist. Her name is Andrea Salcedo. She's an American gynecologist, and she pointed out that the uterus is like an end organ. It's bathed by the same blood supply. So we wouldn't want our organs to be constantly bathed in excessive amounts of sugar and insulin. And could we be thinking that one arm of health to this organ would be actually what we are supplying to it? And it should be supplied with normal glucose, normal amounts of insulin, because insulin is like a growth factor. So even things like fibroids, that is underpinned as well by this excessive exposure to growth factors. So I think knowing all of this about the health related to insulin, so being underpinned by insulin resistance particularly, it makes a lot of sense for women to treat the uterus just like any other organ that needs to be given a very normal blood supply in terms of reduced amounts of inflammation, reduced or normal glucose exposure and normal insulin exposure, and also to limit any excessive exposure to or like an abnormal high amount of inflammatory proponents as well, and immunological factors that can also be carried around in the blood as well. So quite a lot of molecules that can obviously be supplied to the uterus, but you want to actually normalize that to be able to provide a good blood supply to the uterus. So that concept has always stuck with me, which is that uterus as an end organ. And I think there's quite a lot of research in regards to this. It's not new information. It's been seen time and time again in terms of, normal uterine health being influenced by metabolic health. And, we often see higher rates of uterine cancer in overweight and obesity. And this is certainly a relationship, I think, that needs to be explored. When you're treating someone in the clinic, is to actually go back and assess, are they satisfying any markers for metabolic syndrome? And if so, how severe is it? And, what will it take to reverse that? Because that could actually end up being the thing that helps to improve uterine health through normalized exposure to a normal physiological blood supply. So there is this concept that I've been exploring and using to look at with health with women.
So what's a normalized exposure? It's like, do we know what that is today?
I don't. Look, I think that is certainly dependent on the individual. And I think that what that means is reversing any metabolic syndrome and any pre-diabetes. So sometimes you may not actually have people who are coming in that satisfy all of the criteria, or at least 3 of the 5 criteria there to meet metabolic syndrome, which would be, a high blood pressure, higher waist circumference or an abnormal waist circumference, the abnormal blood sugar levels, a higher triglyceride, and low HDL, which are some of the lipid abnormalities. So when you have an individual that doesn't necessarily satisfy all of that, but they're showing clinical signs and symptoms that there is insulin resistance present, then I think it's worth actually delving further and investigating if that's present, and also assessing just normal, asking questions about menstrual health, because you could not satisfy any of those criteria, as I didn't satisfy any of those metabolic syndrome criteria, but I certainly had an abnormal menstrual health happening at the time. And as I was saying before, I think it is like a vital sign for women. If it's not normal if you're not having a normal period, which should come once a month, should be painless, relatively painless, shouldn't impair your work. So you shouldn't be really needing to take a day off and take any analgesia to get through that. And I think a lot of women actually do have quite abnormal menstrual health, but it's sort of never really part of the discussion. And it needs to be asked about. And also, I think women need to be informed that if there is something abnormal going on there, it's really worth pursuing and trying to ensure that you can get back to a period that eventuates every month.
It's that normalization of so much that isn't normal, now. I mean, that is just so common, as you say, women, but think that's all part of it, having, 2 weeks out of every month in, peril in some way when it comes to their cycle. But I love it how you've said that that's not normal. And that's what I want the conversations to shift to, so much is not normal
yes,
today.
That's
And,
right.
the foundation is diet, yet it is just, it's not enough. It's not talked about enough, but,
No.
you can only do what you can do. And, very grateful for the work that you do and, the information that you share. I'd love to finish up though with, one question I love to ask my guests. So you've mentioned a couple of people, but who are the people that you are learning from now? Who are the people that you just love to listen to what they say?
I really enjoy learning from Lily Nichols, who's a registered dietitian in America. She's such a wealth of information when it comes to women's health, and especially in pregnancy. And also, most recently, really fascinated by what she has to say about children's health as well. And children's nutrition. So I've really enjoyed following her work. I'm also fascinated by some of I think the information that Dr. Jamie Seaman provides as well. She's a obstetrician gynecologist as well, who has a great ability to convey a lot of the scientific information which underpins using ketogenic diets and low carb diets specifically for women, and how that can benefit health. And I think she does that in a way that is understandable for a lot of women, and that's something I've really enjoyed following. And I'd also pinpoint the work of Dr. David Unwin, who's a UK GP. I think he's really set the scene for general practice moving into the space of low carbohydrate medicine. And whilst he's based in the UK, I think a lot of Australian general practice, we do look to the UK specifically, maybe even more so than the American context, but we look to the UK for a lot of our guidelines. And because he has done so much research and he's taken the time, and this is something a lot of us don't have the benefit of, which is as clinicians to take time out of our work to go do the research, which takes so much time and effort, to clean up databases of our patients, to look at all the information and then make the next jump, which is to analyze that information and then present it and be able to apply it and then get a journal to select it. It's a huge task. He's managed to get a good team to be able to achieve that. And because there is published literature now on following patients that have been on a different nutrition therapeutic approach, and how he's noticed or been able to de-prescribe medications, I think that's been a really fascinating area to watch. So I'm very hopeful that in an Australian general practice context, this will become more commonplace and normal for us to see de-prescription of medications as people improve their health and well-being on a different nutrition approach.
Amazing. Did you see him when he came out to Australia in 2019?
I did, yeah. And 2019, it sounds so long ago now, but yes. When we could do conferences in person, yes.
That conference on the Gold Coast in, I think it was October 20, it was almost like the last thing that we did.
Yeah.
Of course, COVID hit, but his talk was fantastic. I'm actually going to put the link to when he talked about him being the black swan. I'll never forget that talk. It was such incredible talk, but I'm going to put it down below for anyone listening. They can watch that talk if they haven't seen it. But thank you so much for coming and chatting to me today. I'll have gone on for ages. There's so much I could talk to you about. Maybe one day you'll come back again.
Yeah, I'd love to be back on again.
talk about a few more things. But thank you again for everything you do and chatting to me today, Deepa. It was fantastic. Thank you.
That's okay. Thanks for having me on, Tracy.